Good day everyone, my name is Leanne. I'm a registered pharmacist in South Africa, and today I want to discuss with you some insights that I have discovered regarding the COVID-19 pandemic. I'm going to start with treatments. Now there's three things that I want to look into. Three medications that have been commonly prescribed on COVID-19 positive patients' prescriptions, and I want to see why doctors are prescribing these interesting drugs for this viral disease. Okay. So let's start with the role of colchicine in the treatment of a COVID-19 positive patient. Okay, so this is an anti-inflammatory drug that's been taken orally. It's usually indicated for the treatment of gout, and how it works is that it inhibits the neutrophil and the monocytes to move to the side of inflammation. Alright, it also inhibits the pro-inflammatory cytokines, which is a very big contributor to the disease severity that we see in patients that have COVID-19. Alright, but unfortunately the conclusion of this article was that colchicine doesn't really help with COVID symptoms. It does not really relieve symptoms, so it's sometimes prescribed, but they are uncertain of the safety and the efficacy of this drug. Alright, now the next drug that we're going to discuss is melatonin. Melatonin is most commonly used in patients who are struggling with sleep disorders. But in the case of this viral respiratory disease like COVID-19, it can be used to treat viral respiratory disorders because it helps to prevent oxidative stress. It helps to decrease inflammation and it upregulates the immune system. Okay, so the use of melatonin might be considered in the future as treatment for COVID-19 patients, although it's already been prescribed. I'm not 100% sure if it's already on the guidelines, but it's very interesting. So let's see, how does melatonin work? First thing to know is that melatonin is a sleep hormone and it's secreted by the pineal gland in the brain. And it has the following actions in the body. It's an antioxidant, anti-inflammatory, anti-excitatory. It helps with sleep imitation, and it's immunoregulative. Okay. It also shows some antiviral activity to some extent. So in a respiratory disease, melatonin is used for acute critically ill patients, and what it does, it reduces the basal permeability, it induces sedation, decreases agitation, and increases your sleep quality. Alright, so it's an interesting hypothesis on how they found out that melatonin might be beneficial to treat diseases like viral respiratory diseases. They discovered that bats have an innate resistance to viral infections, and they thought that it might be due to the higher levels of melatonin in bats. And they say you can also explain why older people are more prone to getting COVID and younger people younger than 20 are less prone to get it, maybe because of our concentrations of melatonin that differs between the age groups and the populations. Okay, now let's quickly look at the role of thiamine in the treatment for COVID. Overall, all the vitamin Bs, they work on immune support. They're going to help you have a healthy immune system. It can also suppress the immune activation. It downregulates your pro-inflammatory cytokines. It decreases inflammation. It prevents coagulation from happening. And what I found with patients with COVID-19, it shortened the hospital stay of that patients, which is great. So let's look in specific to thiamine or vitamin B1. We said already it reduces inflammation, but what it also does is it causes an adequate antibody response, and it lessens the severity of the symptoms. Now, the recommended dosage is 100 milligrams a day. That is also the dosage I see on my prescriptions that we do in the pharmacy. And the other thing that's interesting is that thiamine works like a carbonic anhydrase isoenzyme inhibitor, like acetazolamide that goes by the trade name of Diamox or Azomate, and it increases oxygen levels. So it usually Acetazolamide is usually used for the treatment of altitude sickness or patients with pulmonary edema. And the pathophysiology of those two diseases correlates very well with the pathophysiology of patients with COVID-19. So thymine is a great option to use, and it's basically a vitamin B supplement, and it really has an impact, a positive impact, when you're treating a patient with COVID-19. Okay, so when we look at our role in the pharmacy, we're not going to prescribe or give prescriptions, but I just wanted to talk about these three drugs so that you kind of have an understanding on why it's being prescribed. You as a pharmacist, what you can do is you can recommend your patients having an oximeter at home, as the World Health Organization also recommend this, that if a COVID-19 patient is not ill enough to be hospitalized but is recovering at home, have an oximeter and constantly monitor that oxygen levels. Okay, let's quickly look at the supplements that are recommended to be used in South Africa. So the first one is going to be vitamin D. Now you can either take the 4,000 international units daily or the 50,000 units weekly. Okay. Also nicotinic acid, 25 to 50 milligram daily. Zinc is in 20 to 50 milligram daily. Then we have vitamin C, 500 milligram TDS. But it's also given BD. I think as long as you hit that 1,000, at least 1,000 milligram a day, you'll be fine. And then thiamine is 100 milligram a day, as we discussed earlier. Now they also use cortisone. Okay, in the beginning there was some evidence that suggested that cortisone is not the best treatment option, but they do use it. I see it in practice. So for severely ill patients, they will usually start with a BD dose, and then from there on they just continue with that BD dose, and they only do it daily. Okay. Now let's look at the antibody test. And the antibody test I also perform at my pharmacy currently. And there is a huge confusion in the patients between an antibody test and an antigen test. Now, what an antibody test does, it reveals to you if you have COVID in the past. So it only works 14 days after you've been infected. It will show antibodies. Okay. Now, antibodies are also called immunoglobulins, and they are our long-term immunity or our long-term immune response. Okay, so how it works is that when you get COVID, there's an antigen present in your blood. Okay, after that antigen has been there for a while, you get a spike of IgM. IgM drops, and then after that, you get a spike in IgG. Okay, on the COVID antibody test, we are going to look at, we're going to either test for IgM or we're going to test for IgG. This is just an example of a COVID antibody test that I drew for you. So how the test is performed is you basically do a finger prick. You take the droplet of blood, you put it here in the blood section, and you drop 2 drops of a buffer or 1 according to your instructions, and then you wait around 15 minutes. Then the test will reveal to you either if the patient is IgG positive, it will mean a line is formed here, or IgM positive, a line will be formed there, or they can have both. If it's negative, there will be no lines formed, and only the control will be shown there, the line will be shown there. Then the antigen test. The antigen test is to tell you if you're currently infected with COVID. So it's either going to be a rapid test or a test you wait 2 to 3 days. It's going to be a nasal swab that you do. The rapid one is quite interesting. They do the nasal swab, and then they kind of dilute that the contents or the saliva they got from the swab in a buffer solution or in a type of solution, and then that solution is then dropped onto the testing apparatus. Okay, where if they do a nasal swab at a laboratory, you're going to wait a few days. They're going to take that sample that it looks like almost like a cotton bud. They press up your nose, and then they're going to send that thing as a whole. They're going to send it to the lab. So that's the only difference. The only thing that's nice about the rapid test is you get the results within 15 minutes. So that's quite good. Doctors perform it at the doctor's office. Some pharmacies do the testing. So where the other one, you need to go to the laboratory and they have to be tested in a laboratory. Okay, and that's basically what I wanted to share with you regarding the COVID-19 pandemic. and things that I've learned, things that I found interesting. If you have anything you wanted to share or you have questions that you want to ask, please leave it in the comment section below and I'll answer you as soon as possible. Thank you guys, have a great week.